Hey, good morning, everybody. This is Scott coming to you from the Auburn studio, and I want to take a couple minutes of your time today to talk a little bit about knee pain. Now, there's a lot of reasons why you may have knee pain, and I'm not going to discuss all the options today. I really just want to focus on one specific area. But this is a great time that most of us don't have the opportunity to have access to all this equipment, but there's a lot of things you can still be doing, and hopefully you are doing at home, whether it be following our at-home videos that we've been producing, but also use this opportunity to work on a little prehab or preventative exercise. I know a lot of you have knee pain already. Some of you may have knee pain in the future, and that's kind of my goal today, is to give you just one of those options to what could cause that knee pain and hopefully either ease that pain or help prevent it in the future. Now, with the knee is what I like to refer to sometimes as a dumb joint. Now, and it's dumb because it does whatever the ankle and whatever the hip tells it to do. And so today what I want to focus on is hip stability or hip strength, specifically in your gluteus medius. Now, we all know about the gluteus maximus, which is our biggest prime mover and response for hip extension. But the smaller muscle, which is right here in the side of your gluteus medius, and that's going to really keep control of the lateral movement of your hips. And I'm going to kind of show you some examples, and it's going to be exaggerated a little bit, but I want to show you how it affects the knee. And one of the things you could do is to test it, and it's what we call a Trendelenburg sign. To do this, you need somebody to watch your hips from behind, but this is what you're looking for. If you look at my hips right here, my stability, my levelness of the hips, when I stand on one leg, if I've got good glute med strength, I should remain nice and level. Now, if you do that and you've got some weakness, or sometimes it's not a weakness, but sometimes it's just not activated. A lot of us live and work in an environment where we sit all day long. When we're sitting all day long, your gluteus medius doesn't have to work too much. So sometimes it's just not activated, and sometimes we just need to do these exercises, which I'm going to show you in a couple minutes, just to turn them on and to activate them. But this is the Trendelenburg sign. When I stand up, a positive sign, if you see the hip, jut out to the side. Now again, that's exaggerated movement. You're not going to see it move that much, but I just want to show you the example. If I stand and that hip juts to the side, that lets me know that I either have a weakness or an inactivation of my gluteus medius. When you stand on one leg, you should remain nice and level. You shouldn't see that lateral movement. Now, to talk more about how that can affect your knee, and like I said before, your knee does whatever your ankle or your hip tells it to do. And so if I've got a lot of lateral movement in my hips when I'm running, for example, as my hips go to the side, the knee naturally caves in. So the more the hips go to the side, the more that knee caves in. Over time, that causes a lot of stress and discomfort on the medial aspect of your knee. Now, I want you to think about this, okay? Think about running. In an average Orange Theory workout, for example, you may run anywhere from 1.5 to, say, 2 to 2.5 miles is probably the average. Now, think about that as steps and repetitions. It takes roughly about 2,100 steps to complete 1 mile. That's 2,100 repetitions. So with each step, if I'm getting this lateral hip movement, I'm getting that compensatory knee cave in. That's a lot of abuse on that knee. And a basic example, if I were to take this wall over here and take my knuckle, and if I just start tapping my knuckle onto the wall, it may be fine for 5, 10, or even 15 repetitions. But if I were to do that 2,100 times, which is the amount of steps you take in a typical mile, I promise you by the time I'm done, my knuckle's gonna hurt, it's gonna probably be bruised. And that's what happens with our knee. And it's not so much that our knee is the cause, it's the knee is more the symptoms of some weakness up in our hips, specifically and usually in our gluteus medius. So that's what I want you to focus on today, is keeping those hips strong. Think about that during that workout, 2,100 repetitions, 2,100 steps. That's a lot of abuse in the knee. And what I want to show you is just 2 exercises today, 2 exercises that will do a combination of not only activation of that gluteus medius, but also some strength and a bit of an assessment of that gluteus medius as well. So give this a try at home. Your repetition range should be kind of high. Think 15, 20. You can even do a little bit more than that. When you're doing these exercises, look for imbalances or asymmetries left versus right. That's typically where you start to see these injuries as well. If I've got my left side, for example, a lot stronger than my right side, over time you're going to start seeing some breakdown and some potential injury. So look for those asymmetries. If you have an asymmetry, left versus right, that should be your goal during this time when you can't come in the studio. When you come back in, be sure you're strong both sides. So give these exercises a shot. There'll be 2 exercises. Let me know if you have any questions, and hope this helps. Thanks a lot. Okay, our first exercise is going to be a single leg glute bridge. Now this is not only a great exercise to really engage and strengthen your gluteus medius, but it also could be used in assessment as well to maybe see do we have an asymmetry or one side that is weaker or stronger than the other. So here we go for the setup. You lay down onto your back, and then you want to bring in your heels close to your butt. Now from this point, we want to focus on just our glutes. So the next step is we want to go ahead and pull your toes off the ground so we're just pushing through our heels. As we push through our heels, let's be sure that we're just engaging our glutes. The next step is we're going to pull one knee in tight to your chest. Now the tighter the better. What this is going to do is ensure that we're just working the glutes and not working our low back. As your leg is loosely into your chest, you have the more tendency to work into your low back. So from here, squeeze tight your chest. My right heel is down to the ground, driving through my glutes, and then just straight up. Pause for one, and then down. And you want high repetitions here. So we're going to start with about 15 to 20 repetitions. Now as you're doing this exercise, also note, as you change sides, again, squeeze tight. How does it feel right versus left? Are you doing the 15 to 20 repetitions just as easily on the left as you are the right? And if not, that could be a good indication of a potential muscle imbalance that can also be leading to some of that pain and discomfort. So that's the first exercise, single leg glute press. All right, exercise number 2 is going to be our single leg reach. Again, another great exercise that number 1 is going to work on balance. Number 2, stability at the hips, specifically with that gluteus medius. Okay, all this, the goal here is to give more support at your hips so that way your knees are taking less stress. So my setup, you need a target. This could be a wall, it could be anything, but I'm going to go to my target and give myself about arm's distance and then take one big step backwards. That's going to be my reach distance. Now to start with, I'm going to go ahead and reach or lift my right leg up. So in the stance, left leg is raised up, right leg has a slight bend. Since my left leg is raised, I'll be reaching with my right arm. As I do this exercise, it's important that I'm pivoting at the hip. I'm not just bending forward. So I pivot, reach back with the leg, and reach forward with the arm, and back to my start position. Again, trying to keep as stable as possible. By reaching with opposite arm, opposite leg, that's going to keep my spine nice and neutral and my hips nice and level. Our focus here, 15 to 20 repetitions, and then change sides. So this time I raise my right leg up. Again, left leg, which is my down leg, has a slight bend. Right leg reaches back, left arm reaches forward, and reset. If you notice as I reach forward with my left arm as well, I like to have my thumb up. That just keeps my upper body posture good as well. If you do struggle with balance, it's okay to just tap that foot down and then work. If you don't have to tap down, it's going to challenge that stability and that gluteus medius control more. And that's going to be your single leg reach. Again, 15 to 20 reps. Look for that ease and that asymmetry, right versus left. See how you feel.